They are called bath salts, but they are not for the bath. The so-called bath salts and synthetic marijuana are a new genre of drugs gaining popularity among youth, and they are dangerous.
We're focusing on it a lot more, particularly because the most recent survey of Monitoring the Future, the numbers according to the survey instrument are shocking. 1 in 9 high school seniors experimenting with K2 or a synthetic marijuana, and that causes us great concern.
During a briefing in Washington, D.C., officials really stressed how quickly these drugs cause severe and sometimes long-lasting effects.
Poison control centers nationally, about 20% of our calls usually come from healthcare facilities. The rest come from mainly home settings. With these drugs, we're really not getting calls from people at home saying, hey, I used this yesterday, I'm feeling a little weird, am I going to be okay? Over 90% of these calls are coming from healthcare facilities. The physicians, in some cases, still aren't aware of what these products are or what they can do or how to treat these patients. And the patient's symptoms are so severe that they need to be in a healthcare facility.
These drugs are sold legally and they are marketed as safe.
With other stimulant drugs, cocaine, methamphetamine, we usually use drugs to help calm those symptoms down. And then as the drug wears off, the patient's better. With these drugs, not only do they have the stimulant effects, but they also have psychosis. So we tried our typical drugs to use, and in some cases they're effective. In other cases, we've had to use antipsychotic drugs, and in some cases, very powerful drugs, almost like anesthetics, to bring them down to make their symptoms stop. And it's very, very challenging. It's challenging as a clinician to recognize the symptoms and for us to formulate appropriate therapies.
Federal officials are working on passing legislation to ban these drugs.
I don't know that we can get in front of it to stop it. I think the best we can do is try to keep our education efforts up, talk to our law enforcement, keep our legislators informed so we can have new legislation if we need to. We're not going to make it go away. Some of the people who manufacture these things have said, for every one you identify and ban, we have 6 more. We're not going to release them all at once, because if we do, you can identify them and ban them all at once. So I don't see the problem going away anytime in the near future. We just have to have a concerted effort to try to be as aware as we can to stay up with it.
This is Nasim Miller.